That's a pretty hard act to follow, Brett, but I think I would say that I guess herding cats doesn't only happen in the public mental health services. But I picked up on one thing that was said towards the end there. I wouldn't work anywhere else, so I think that's cuts across both places. And Belinda, thanks for the introduction and setting a bit of context there for us. So my job today is to talk a little bit about a brief overview of what RFQ's been doing in relation to the result out of the RFO process. It's obviously a lot smaller scale than we've just listened to, but that's fine. So one of the reasons I guess this would be useful, because we've heard sometimes from people that haven't heard much from RFQ, what have we been doing? So hopefully I'll answer some of those questions today. And of course, we're also aware of how we were profiled in the media release at the end of the RFO process as well. Okay. Just some background for Richmond Fellowship Queensland. We're part of an international movement founded in Richmond in Surrey, in England, in 1959. Independent not-profit company with independent board, established in 1974 in Metro North here, in Clayfield. And we still have a property there at Eliza Street in Clayfield. We've got cooperative links with other Richmond Fellowships in Australia and the Asia Pacific as well, and some of which includes a two-yearly forum, International Recovery Conference, which we'll be having here in 2016 as well. We'll be our turn to host that. So whereabouts are we? So I'll talk about some idea of our footprint. So we have services in 5 HHS areas, Metro North and South, West Moreton, Toowoomba, and up in Wide Bay. What we do in those areas, we have a therapeutic community here in Eliza Street in Clayfield. We're a HAS provider in a number of those HHS areas, also providing home-based outreach support. We have a couple of day activity centres, one in Metro North and one in Logan as well, which is funded from the Commonwealth Government. There we provide social housing support, particularly in West Moreton HHS and in Toowoomba. And we have post-prison and court support services. So we've been providing transition support for people with mental illness leaving the correctional facilities in the southeast corner for the last 7 years. And we provide those services for all the correctional services in the southeast corner right up to and including Maryborough as well. We have another team in Wide Bay doing that. We're also involved in Partners in Recovery, and we're across 5 HHS areas there. We're on membership of 5 consortium managed communities there. Brett mentioned the benefits of being involved in clinical research, and I thought perhaps something to mention at this point as well in terms of what we've been doing is over the last number of years we've been involved with 6 universities in research projects and evaluation projects, which, as Brett pointed out, the advantages of people are attracted to the organisation because of that, provides better services and recovery-based services, which at best practice, arguably, as a result of being involved in those recovery, in those research activities. So coming down to Metro North, as Belinda mentioned, there was no new money coming out of the RFO process. So we obviously were surprised and delighted with the outcome for ourselves, for Richmond Fellowship, out of the RFO process. In terms of Metro North, the existing services we retained was our Eliza Street community, which is a 14-bed transitional residential community. As I said, been operating since 1974 in Eliza Street in Clayfield. We also retained our Redcliffe Day Activity Centre and home-based outreach there in Redcliffe as well. The Brisbane Independent Living Service is a program funded from communities. It's been there since about 1992, obviously not funded through health. In terms of new services for Metro North, it really only comes down to 2. We're lucky enough to receive the Resolve funding, which was previously provided by Mission Australia, and also part of the new services is our day activity and home-based outreach service operating out of Caboolture. So there'll be 2 areas of emphasis will be Caboolture and Redcliffe. there as well. So in terms of what we've been doing over the last little while, I suppose our first concern was in terms of client transition, transitioning clients from a range of organisations that had lost funding. So that involved meeting with 14 different organisations, and clearly when you're doing that, some of these are very difficult conversations because you've been successful in terms of retaining our funding, and then you're dealing with organisations that have lost funding. So that's a difficult process for a lot of organisations who also have to then go on to either restructure or substantially reduce their services. So there's a lot of organisational stress at the time when you're having these conversations, and you're also trying to look after the client transition process as well. Bearing in mind that probably that's difficult because some of the criteria has changed, the emphasis might be changed from what people who are expecting to receive services might not be receiving services going forward, particularly for the sheer size of the expectations in relation to that. So we've been working across the 5 HHS areas. The main emphasis has been on client transition, so ensuring that everyone who needs a service is provided a service, and that's followed up from us as well. So what the future might look like, I guess, for us is looked at obviously in the context that Brett provided around health reform. So clearly there's a challenge for improved relationships between mental health services and community mental health services. And I think part of the move towards that, of course, as well, is the work that PIR's been doing, bringing people together, working together in collaboratives to improve these relationships. I think Pauline mentioned this morning as well, there's still probably some more work to be done with that, but we're very pleased at how things are working there. Clearly, some of the work involved for us is to connect up with the HHS mental health services at a whole range of levels to ensure that we meeting health's demand for services. Brett talked about discharges on Friday afternoon and the pressure that the mental health services are on with the limited beds. So clearly that's what we want to work with the HHSs to address, to look at using our resources there. That's an ongoing conversation. We're not finished with that whole process yet. But that'll emerge as we move forward and have further conversations. So some of the gains will be around developing subacute capacity and looking at things, alternatives to hospital, diversion from ED, extended hour services, managing complexity, and hospital and custodial transition. So there's a fair bit of work to do in all those different spaces. Okay, that's pretty much about all I wanted to say this morning. And there's some contact numbers for us there, but that's it. Thank you.